with their iron, but not to take it with milk. Let them know so that they're not alarmed if they're taking an iron supplement that their stools will be very dark black or dark green color from the iron. Very normal. Alright. Up next are our torch infections. I'm going to go through all of them. You don't have to know specifics of these so much, meaning in how they affect the baby, because they're all pretty much the same. Okay, but you should know what falls under the category of a torch infection. Okay, so torch would stand for toxoplasmosis. The O is for other, which is hepatitis C. The R is rubella. The C is cytomegalovirus or CMV, and H is herpes. These are infections that can be devastating to the baby or the newborn. Sometimes they're damaging anytime they're acquired, while others are harmless unless they're acquired during pregnancy. There is no effective therapy. Immunization can prevent some of them. Okay, we have a hepatitis B vaccine, we have a rubella vaccine. We don't have a vaccine for CMV or toxoplasmosis. So, you'll notice as I go through these too, a lot of the issues that these cause for the baby involve deafness. Okay, deafness, blindness, microcephaly, which is a small head, developmental delays, congenital cataracts, usually things up here. So CMV, the infected infant can have intellectual disabilities, seizures, blindness, deafness, dental problems. They have a characteristic rash called a blueberry muffin rash, and that is due to PPI, which are little vessels. Treatment for this, there is no treatment. Therapeutic abortions are often offered if this is diagnosed early enough in the pregnancy.
Sorry, don't they say like 85% of the population
Has CMV?
Yeah. So,
Because if you already have it, it's fine. But if you get it
you get it
for the first time, well, that's where you have a problem.
Okay.
Yes, I think it's almost transmitted like in the diapers of newborns. Like everybody has it, but it's when you acquire it, not everybody, but a lot. When you acquire it for the first time during pregnancy, that it can cause problems for the baby.
Okay.
And here's that blueberry muffin rash. It's not permanent, it will go away, but it's from all those petechiae. It's like a bunch of little bruises, but they call it blueberry muffin rash for that reason. I've only ever seen this once. One time. Huh?
Look like somebody beat them.
Yeah, he looks like he got in a fight. It'll go away, but the effects of the CMV infection will not. Rubella, not an issue to the mom, mild viral disease, low fever, no rash. It is destructive to the baby if mom gets rubella. If she receives a rubella vaccine before pregnancy, she should delay getting pregnant for a month following vaccination. When you become pregnant, they check your titers. If you are not immune, you should not get a rubella vaccine until, I'm sorry?
I think it was active or something like that.
It's an active form of the virus. So, you will, if you're not immune to rubella, they'll just wait and vaccinate the mom after the baby's born in the hospital. Effects on the baby, microcephaly, so small head. Your head is small, brain is small. Intellectual disability, cataracts, deafness, can have cardiac effects, growth restriction. Herpes, 2 types of herpes. Type 1 is likely to cause fever, blisters, or cold sores. Type 2 causes genital herpes. After you have that primary herpes infection, the virus kind of lays dormant in the nerves and can be reactivated at any time. Initial infection during the first half of pregnancy can cause spontaneous abortions, growth restriction, preterm labor. Baby can be infected one of 2 ways. When lesions of the primary infection are present during labor and the virus kind of ascends into the uterus after the water breaks, and spreads to the baby, or the baby has direct contact with infectious lesions during delivery. So, if mom has active herpes, she has a C-section. Okay, we don't want baby to be in contact with them. Now, if she shows up in labor with active herpes and the baby's halfway out, then delivery is just gonna proceed. We're not gonna put the baby back up. They're already in contact. If they're on their way out, they're already in contact with lesions. Neonatal herpes can be localized or widespread. If we're concerned that the baby has been in contact or may have acquired the virus, then they will be usually hospitalized and treated with like acyclovir for 3 weeks. We got like a central line and everything. We want to avoid, because there's a very high mortality rate, so we want to avoid contact with lesions. Mom and baby don't need to be separated. We just don't put baby in contact with lesions, which once the baby is born, there's no reason for the baby to be back there having contact with any vaginal lesions. Breastfeeding is fine as long as there's no lesions on the breast. Okay? Just keep the baby away. Hepatitis B is transmitted by blood, saliva, and vaginal secretions, semen, and breast milk. It can also cross the placenta. So the baby can be infected transplacentally, meaning it can pass through the placenta and infect the baby. Or by contact with blood or vaginal secretions during labor. So babies who are born to moms with hepatitis B. Hepatitis B is a vaccine that every baby, unless the parents decline it, every baby will be vaccinated now in the hospital. If not in the hospital, usually at the first pediatrician appointment. Okay, so Hep B is on the childhood immunization schedule. If the mom has hepatitis B, that baby will also receive hepatitis B immunoglobulin for that temporary immunity right after birth, and the regular Hep B vaccine for long-term immunity. Okay. All pregnant women are screened in the first trimester. If you are high risk, then they may screen you again in the third trimester before the baby's born. This could be, not, risky behavior necessarily, but, if you need blood transfusions frequently, or if you're on dialysis, like those are all higher risk for contracting hepatitis B. STIs, common mode of transmission is intercourse. They're sexually transmitted. Syphilis, gonorrhea, chlamydia, trichomonas, genital warts can all be transmitted. Bottom line is, if an STI is discovered, any sexual partner should be treated as well and complete their course of treatment to avoid just spreading it back and forth to each other. Up next is HIV. HIV is a causative organism of AIDS. Virus cripples the immune system, and that's usually what leads to death as the secondary infection. Okay, so control infections has increased life expectancy. HIV is acquired in one of 4 ways: sexual contact, needle sharing, parenteral or mucous membrane exposure, and perinatal exposure. So the baby can be infected via the placenta, through contact with maternal secretions, and also through breast milk. There is a 20 to 40% chance of transmitting the virus to the baby, and it takes a full 3 to 6 months for the parents to know for sure. Because the baby will be positive after they're born. So they take a whole course of meds, and they'll get rechecked at 3 to 6 months. I will say though, there's so many commercials now for medications, and I hear them say, if counts are low enough, you're no longer able to transmit the virus, right? So I would think the same goes for this scenario, right? If their counts are low enough and they're not considered able to transmit it, then there'd be an even lower risk of transferring it to the baby. Potentially they could have a vaginal delivery and not need a C-section. Maybe they could even breastfeed if they wanted to. So, but that would be case by case. Toxoplasmosis, it's a parasite. don't change the cat litter. Stay away from the cat litter. This is why you aren't supposed to clean litter boxes when you're pregnant. It can also be transmitted through raw meat. Okay. This can go through the placenta and be transmitted to the baby. And the baby will have low birth weight, enlarged spleen, they can have jaundice, anemia, neurological damage. Nothing good. Treatment, medication to treat the mom may reduce the risk of a congenital infection for the baby. Treating the infant aggressively following delivery may reduce the severity of the defects. Preventatively, make sure we cook all meat thoroughly. Wash your hands and kitchen surfaces if you're handling raw meat. Avoid uncooked eggs and unpasteurized milk. You know, some of the things like the moldy cheeses like blue cheese, gorgonzola, those types of cheeses they say to avoid as well. If you're buying it in the supermarket, it's usually pasteurized. I don't think they can sell things that are not pasteurized in our big box supermarkets. You'd have to go to like a farm store to get unpasteurized dairy products. Wash fruits and vegetables and avoid materials contaminated with cat feces. And that includes, you know, thinking outside the box. If you live someplace that there's a lot of stray cats and you like to garden, like potentially they're using the garden as their litter box, sandboxes. You know, the world is their litter box if they're outdoor cats. They can go wherever they want. So just be mindful. All right, Group B strep is the next one. Group B strep is quite a, this is definitely important in maternal care. Many women are colonized with Group B strep. Okay. You can be positive with one pregnancy and negative with the next. You can almost be negative when they do the swab and positive when you deliver, depending on when they do it. So everybody gets swabbed around 35 to 37 weeks. If you are positive, it just changes, you know, a little bit of the management when you're in labor. They're going to give you antibiotics so that we decrease the chance of infection spreading to the baby. Monitor a little bit more closely for infection. Potentially, you know, baby might have to be treated as well, because we don't want the baby to get that infection. It can be catastrophic for the newborn. It's a significant cause of maternal postpartum infection, so elevated temp, rapid heart rate, abdominal distension can all result from Group B strep sepsis. It can be deadly to the infant if the baby contracts it and is not treated promptly. Okay. So antibiotics in labor and possible treatment of the baby with antibiotics afterwards. There's a higher risk, let me just throw in here. The longer the mom is in labor, the longer the water is broken, the higher the chance that infection happens, right? The longer the baby's out of their little bubble, the more chance there is for infection. All right, tuberculosis is up next. Everyone's got their PPDs, you know, quantiferins. Increasing incidence in the U.S. Moms are tested, you guys know, with PPD, quantiferin gold, T-spot, all of those. If any of those are positive, they'll need a chest x-ray, you know, to make sure that we don't have active TB. If there is active TB, then the health department has to be notified because it's a communicable disease. If mom has active TB, baby has to be kept quarantined from the mom. Or mom, I guess, is the one that's quarantined. Okay, so she can pump, the baby can have the breast milk, but they can't have contact until it's over. Baby might be treated as well. Okay, UTIs. Just going one complication after the next in this chapter. All the things that can go wrong. UTIs, common in women anyway, but you know, common during pregnancy as well. Short urethra and ease of contamination. Everything's kind of close together. Pregnancy also alters the self-cleansing action because of the pressure on the urinary structures. She may not empty her bladder completely. Right? If she doesn't empty her bladder completely, that urine that stays in the bladder is more prone to bacteria and, increased risk for a UTI. All right, our main concern with a UTI that is asymptomatic is that it can progress into cystitis or a bladder infection. And if that's not treated, then pyelonephritis or a kidney infection. So knowing the signs and symptoms of cystitis and pyelonephritis is important. For bladder infection, they have burning with urination, increased frequency and urgency. They may have a temperature, maybe not. Pyelonephritis will have a fever. They will have chills. They'll feel sick. That flank pain right here, like where your kidneys are, flank pain or tenderness, maybe nausea and vomiting. All right, nursing care, instruct to wipe front to back. If they have a baby girl, remind them to wipe front to back for the baby girl too, even more so, because everything's super close together. And definitely a huge ease of contamination there. So front to back or top to bottom when you're changing a diaper. Increase fluid intake, or make sure you have adequate fluid intake. The more you drink, the more you pee, you flush everything out. Teach those signs and symptoms so they know when to seek treatment, and make sure they adhere to their antibiotic treatment plan. Finish your antibiotics. Oh, I felt better. I stopped taking it. Okay. Couple more slides here in this chapter. So, environmental hazards. What in the environment can have an impact on development of the baby? So that's called a teratogen. And that could be drugs, chemicals, infectious agents, and radiation. All right, and this is just to I like this image because if you look at this orange color area, up until this part right here, this is where they're at greatest sensitivity to a teratogen, and that is like 9-10 weeks. Like some people don't even know they're pregnant. And that's when the baby's at most risk for being affected by something in the outside environment, having an impact on their development. Right. The specific anomaly that develops depends on the time of exposure in relation to the stage of development. So, if it's during this time frame from 3 to 6-ish weeks, it could be the limbs, at the heart very early on, 3 weeks. You're pregnant in 3 weeks, most of the time. But that's kind of when everything can be impacted, and you don't have to know the specifics of that. So just like to look at it to visually show. Mm-hmm. What?
I said it's not a tail.
Yeah. That turns into your spine and your legs. They look like little gummy bears. Bioterrorism, I don't go too much into this either. I always just say, no matter where you're working or where you find yourself, to be aware of stranger things that are happening. If you have someone come in with like a strange rash, and then a few days later and somebody else has the same strange rash, and they're like, gee, that's 2 this week, and then you see another one, like, I'd be like, what's going on, right? And it's not your job to play detective. You tell your person you report to, like, this is the 3rd patient I've had, this week with this weird rash, like, what's going on? Or respiratory symptoms when you're not really expecting it, like over the summer, right? It's not flu season. You're not really expecting everybody to have all these respiratory infections, but here you have a bunch of people coming in with respiratory infections. So just be aware of things that don't seem right or seem a little bit out of the ordinary. All right, substance abuse. When there is substance abuse, it's often multiple drugs. There can be some lifestyle factors that exist as well, such as poor prenatal care, maybe sexually transmitted infections, things like that. When we're looking at therapeutic medication, it's risk versus benefit. And we talked about that in chapter 4. With alcohol, a single episode of consuming 2 alcoholic drinks can lead to the loss of some fetal brain cells. So, babies with fetal alcohol syndrome sometimes have that microcephaly or that small head, and thin upper lip, smooth philtrum it's called. So this little groove that most of us have right here, there's very smooth, thin upper lips. Their eyes are a little bit more narrow at the end, so some features. Trauma. 3 leading causes of traumatic death or perinatal loss are unintentional injury, motor vehicle accidents, and domestic violence. Falls are not uncommon, especially the more pregnant you get, right? You get a little front heavy, your center of gravity is off. You know, a teeny little trip you can't recover from as quickly as when you're not pregnant. Physical trauma. If there's physical trauma, prenatal care may be late or erratic. You want to observe, just like any other suspected trauma, observe for bruises in different stages of healing. Determine whether other children are being hurt. Okay, if there's other children in the home, you have to report that. And also determine if there's factors present that may increase the risk for, or it may escalate the violence. So, you know, are there weapons in the house? Like, is this going to get worse? Okay, and when we talked about placental abruption, that is why we have 4 to 6 hours of monitoring after any trauma. Make sure that placenta is not affected. All right, avoid laying flat when you have a trauma patient who is pregnant due to our supine hypotension syndrome, right? You've got to put a little wedge underneath the hip to tilt the uterus off that superior vena cava. I mean, with a trauma, it's going to be, you know, if the baby's of a viable age, then a lot of times they will just deliver and then treat the mom. All right, effects of a high-risk pregnancy on the family. There can be a disruption of roles. The mom may have to be on bed rest at home or in the hospital, which means she's not able to do all the things that she's used to doing or that the whole house is used to her doing. Financial difficulties. If she's not able to work, then she's not bringing home a paycheck unless she has, you know, FMLA or things like that. Delayed,
Or she makes a lot.
Or she makes a lot, yeah. Delayed attachment to the infant. And this is not uncommon either. If you have a history of a lot of losses, then sometimes, you know, bonding with future pregnancies can be affected because, you know, you may not want to bond too much because your history is lost. So that's how sometimes moms will protect themselves. Loss of the expected birth experience. With a high-risk pregnancy, you may not get to have a home birth if you want, or you may not may not be able to go to a birthing center. You know, you're at high risk. You're going to have high-risk OBGYN who will monitor you closely for complications. Okay. Interventions for the grieving process. Allowed parents to remain together in privacy. You know, every facility has memory boxes, little mementos that we can put together. We can get footprints, handprints, a lock of hair. There's usually an outfit. I usually, you know, especially if it's a preemie, like a tape measure that kind of shows what their length was. Pictures, but most people have phones that have cameras on them now. Back when I first started, that was not the case. Okay? We had a digital camera with a little printer there, and we could print out pictures. But there's also discuss religious and cultural rituals. So, you know, maybe they want the baby baptized. there should be somebody in the facility that can come and do that. If not, then anybody can really do it. There is a company or a volunteer group called Now I Lay Me Down to Sleep. And they are volunteer photographers that will come when called to the hospital or wherever this setting is and take pictures for families if they lose a child. And they're, you know, they're good with cameras, so they take nice pictures for them to have as a, and I do not think they charge anything. And this is like an example of a little bit there. Okay. Why don't you guys take an early break? We gotta do a little, I'll let you out early, but we gotta get a little bit of 6 done. 6 is a very big chapter.
Yes, it is.
So,